Let's dig into that, Captain Thomas. One non-conformity I still see often, it's around water distribution system, backflow prevention devices, inspection and testing. That's straight out of section 5.7.2. It's basic, but it tells us whether the water is potable or technical, and mixing those up can have a serious consequences.
Yes, and let me say this to all our listeners in senior leadership. The operations manual is your blueprint, but your teams are the builders. If the blueprint isn't followed by the builders, if the requirements aren't taught, tested, and supported with some systems and accountability, then all we're doing is setting the stage for failure. And remember, officers and crew must truly embrace this culture.
Well said, Captain Thomas. And if you are in training or management role, I encourage you, walk your ship with a manual in hand, not just to check off boxes, but to ask questions like, do we understand this? Does this make sense operational? And what would you do if the system failed at sea? And as you know, operations manual doesn't always give the underlying why to the requirements. That's where we, as GPHS trainer, play an important vital role in providing the knowledge and the understanding needed of the VSP requirements.
Exactly, because when the VSP inspectors come on board, they're not just looking for violations of the operation manual. They're looking for evidence of a positive public health culture. They want to be assured that officers and crew are addressing the risk factors that cause outbreaks, and they have active managerial control over their operations. Back to the gold standard. And that, in the end, is what truly protects our guests and crew.